Hi, I'm Daniella Etzion, and I'm here to submit my midterm. So we are required to watch a video and answer some questions. The first question was why Robert's experience participating in research study was troubling. She was troubled because she was asked to check a box with her race, but she wasn't sure how to answer the question. She wasn't sure to know if they wanted to know the diversity background or to see if she was at risk for certain genetic traits. She's from a mixed family, with her father being a white European and her mother being a black African. An example of how Robert illustrates how race shapes medical practice. It shapes physicians' diagnosis, measurements, treatments, prescriptions, and even the definition of disease. When genetic genome was announced, it was said that 99% of all humans' genomes are the same, and the 1% difference does not fall into the racial category. Race-based medicine causes a distraction from the social determinants that cause appalling racial gaps in health. Robert says that the doctors are distracted from the patient's own illnesses and their family's history. She says that they use racial categories to treat different races differently. For example, blacks and Latinos are twice as likely not to receive pain medications as whites just because of stereotypes. Three examples from the readings to answer the following question. Why is race-based medicine inadequate and possibly harmful for addressing patients' health concerns? According to the Indian Health Service and the Sterilization of Native American Women by Jane Lawrence, Native Americans accused of the Indian Health Service of sterilizing at least 25% of Native American women who were between the ages of 15 and 44 during the 1970s. Army's physicians took steps to curb smallpox and other contagious diseases in the Indian tribes living in the victims of military posts. This shows how they sterilized the Native Americans women in order to, without their permission, in order to stop further diseases, and it's against the law now, kind of, to sterilize women. According to racial categories in the medicine practice, how they are used by Lunda Braun, Anne Franco Sterling, Duna Flynn Willie, Evelyn M. Hamwins, Alnadrel Nelson, William Quivers, Suzanne M. Verby, and Alexandra E. Shield. And I found this quote, and it really shows how race is shown today. In a Fox television medical drama, a black patient with a heart disease refuses a hospital's physician prescription for what clearly is supposed to be a Bidil, the drug approved by the United States Food and Drug Administration, only for self-identified African Americans. The Dr. House, on seeing the patient for the follow-up, insists on the same prescription. The patient again refuses, telling the House, "I'm not buying into no racist drug, okay?" The House, a white physician, asks, "It's racist because it helps black people more than white people. Well, on behalf of my peeps, let me say thank you for dying on principle for us." The patient replies, "Look, my heart is red, your heart is red. It makes no sense to give us different drugs." I find this really moving to show how all of our hearts are the same, and based on race doesn't determine what drug we should receive. If someone has a heart condition, it is because of their genetics or their health, not because of the color of their skin and their race or where they're from. All hearts are red. According to Inescapable Paradox, Diabetes, Progress in the Ecology of Inequality by Matthew Kindle, Renewed attention to the dietary changes, like the widespread consumption of simple carbohydrates, has led some researchers to question the long-held assumptions that all calories are metabolically equal. This quote was taken from an article that talks about how the Pima Native American tribe is known to have diabetes, and how many believe that it was in their genetics to receive it. But recently they discovered that it was because of their living conditions, the foods they were receiving, and how they were living in a poor condition, and that is one of the main causes for it. Yes, it is genetical, but because of their living conditions, they have a higher rate of getting diabetes. So that is my midterm video.